안녕하십니까. 저는 대구 경북 권역심뇌혈관질환센터 재활센터장 이양수 교수입니다. 보행 재활의 중요성과 방법을 동영상과 함께 설명드리겠습니다. 뇌졸중으로 인하여 여러 가지 장애가 발생하고 이에 대하여 다양한 재활 치료가 실시되고 있지만 그 중에서 보행 재활이 중요한 이유는 다음과 같습니다. 보행 재활은 재활 치료 중 효과가 가장 큽니다. 보행 재활을 통해서 운동 장애가 심한 뇌졸중 환자분도 보행 기능을 회복할 수 있습니다. 이 사진은 우측 다리를 움직이는 부위에 뇌경색이 발생한 60세 여자분의 사진입니다. 뇌졸중 발생 후 6개월이 지난 후에도 우측 다리를 움직일 수 없었지만 적절한 재활 치료를 통해 3개월 후 보행이 가능하게 되었습니다. 뇌졸중으로 인해 다리가 전혀 움직이지 못하더라도 적절한 재활을 통해 다리를 움직이고 걸을 수 있게 됩니다. 둘째, 보행을 할 수 없게 되면 뇌졸중 환자분이 건강을 유지할 수 없게 됩니다. 뇌졸중 발생 1년 후 생존에 가장 중요한 것은 보행을 할 수 있느냐 없느냐입니다. 셋째, 보행이 불가능한 환자를 돌보는 것은 신체 건강한 성인만 가능합니다. 또 이러한 분들을 돌보는 데는 매우 큰 육체적 부담을 줍니다. 뇌졸중의 보행 재활은 환자의 상태에 맞도록 이루어져야 합니다. 때로는 마비된 환자가 충분히 훈련되지 않는 상태에서 타인의 도움을 받아 보행하는 경우가 있습니다. 이러한 훈련은 환자분과 치료사를 힘들게 할 뿐 아니라 잘못된 보행을 초래할 수 있습니다. 이 동영상은 잘못된 보행을 하는 것을 재현하였습니다. 체중을 지탱할 때 혈관들이 자연스럽게 굴곡되지 않고 과신전됩니다. 그림에 나오는 것처럼 먼저 근력 강화 훈련을 실시하고 발판 올라가기, 발판 내려가기, 발판 위에서 아래로 발 닿기를 차례로 훈련한 다음에 마지막으로 실제 보행을 훈련하면 더 편하게 훈련할 수 있을 뿐 아니라 바르게 보행을 할 수 있습니다.
Weight-bearing exercises is an effective training method as it stimulates the contraction of the paralyzed lower limb muscle. The patient is practicing to lift the bottom up in order to strengthen the lower limb muscles. However, it is difficult for patients to conduct this movement. Some people use a clival to bear weight on the paralyzed lower limb, but a sliding rehabilitation training device allows for easier exercises. The rail and wheels within the inner part of the sliding rehabilitation training device allows for non-frictional movement. Training can be conducted by using lower limbs of both sides for paralyzed patients. The patient lies on top of the sliding rehabilitation device while placing both feet on foothold. The angle of the device is adjusted at 25 degrees. Adjust the knee joint exercise scope to 60 degrees. Use the non-paralyzed leg to do a slow bending straightening motion and repeat 100 times. The paralyzed leg is repeatedly flexed and extended while bearing weight during this exercise. This exercise allows for recovery of the paralyzed lower limb. After the paralyzed leg recovers movement from this training, the sliding rehabilitation training device is used, utilizing paralyzed legs only. Place a non-paralyzed lower limb on top of the foothold in order to exercise with the paralyzed leg. For first-time users, adjust the angle to 4 degrees. The knee joint exercise scope will be conducted at a 20-degree angle. Once patients gradually gain strength in the paralyzed leg, increase the knee joint motion range to 60 degrees as well as the angle of inclination. Once users are able to handle flex extension of lower limb 100 times in a 20-degree incline angle using only their paralyzed leg, foothold climbing exercises can be conducted. The sliding rehabilitation training device can also be used in games. This device allows users to play fruit harvesting and butterfly catching games using the flex extension of their lower limb along with left-right movement of body weight resulting in a fun rehabilitation treatment. After strength of the paralyzed leg is somewhat restored, patients can proceed with the foothold climbing exercises. In the beginning, they may use a safety bar to do step-up exercises. Place the foot of paralyzed lower limb on top of the foothold. Use a limb to slowly lift body onto the foothold. Once users become familiar with this routine, practice going up the foothold without holding the safety bar. Remember to prevent knee joint from moving outwards or becoming hyperextended. Patients who have difficulty in body control often lean back when sitting in chairs or beds. It is necessary to move the body forward in order to recover body control. A plate is installed in the wheelchair to prevent the body from falling forward. This facilitates movement of the body while leaning forward. Move the body into a vertical position by placing both arms above the plate. Slowly increase the sitting position time by holding both arms up and preventing the back from touching the backside. Once users are able to sit down for 2 whole minutes without leaning backwards and using hands, practice extending arm in a forward motion. For safety measures, place a targeting object above the patient's bed or the medical table and practice stretching arms forward. Once leg power and sitting position balance is recovered, balance training may be conducted in a standing position. The exercise is stepping down foothold. The patient stands on a wooden foothold and supports the body weight with the paralyzed leg. Then the patient steps down the foothold with the non-paralyzed leg. For first-time users, hold the safety bar with hand to step down the foothold. Once users become familiar with this exercise, practice without holding the safety bar. Once user becomes acquainted with the stepping downwards exercise, conduct advanced training by moving foot from foothold to the ground. While holding the body weight with the paralyzed side, use the non-paralyzed foot to touch the ground and move back to the foothold. During this movement, the heel of the paralyzed foot must come in contact with the foothold. Start by touching the floor with the end of feet. Once users become familiar with this movement, practice touching the ground with heel. Once users become familiar with touching the ground with feet from a wooden foothold, practice on top of a rubber foothold. By using the vertical balance training device, users can have fun while exercising and training in a standing position. Play different games by moving in a vertical and horizontal direction based on center of weight. Start training by holding the device with hands for early adaptation. After the adaptation stage, train without using hands. Actual ambulatory training will be conducted once patients regain strength and become familiar with the sequential training of stepping up the foothold, stepping down the foothold, and touching the ground with feet from the foothold. The patient can now maintain body weight and balance with paralyzed leg. Thus, there is no need for the therapist to physically support the patient. The therapist simply needs to stand by the patient in case of falling or accidents. Most patients suffering from stroke can recover their walking capabilities through correct and ambulatory trainings, even if motor impairments are severe. I sincerely hope that more and more patients will be able to walk according to their will.